Within the head and neck region, there are muscles that allow for facial expression, muscles that control the tongue and assist with speech and mastication or chewing, and muscles that allow for movement of the head and neck. For this unit, we only look at two of these muscles, the masseter, which sits on the corner of the mandible or the jawbone, and the sternocleidomastoid muscle, which runs along either side of the neck. So the masseter muscle is this muscle here, and it originates from the maxilla and the zygomatic bones. So our maxilla bones, remember, form the top part of the jaw, and our zygomatic bones are our cheekbones. It then inserts into the bottom corner of our mandible. Now, when a muscle contracts, it will shorten, and the point of insertion moves closer to the origin. For the masseter, this means that this bottom section here moves closer to this top section here, which elevates the mandible and assists in closing the mouth and in chewing. The sternocleidomastoid muscle, which is this muscle here, but can also be seen on an anterior view both here and here, is a paired muscle which runs down either side of the neck. This muscle has two heads or two portions. A sternal portion, which is this section here, which originates from the manubrium or the top part of the sternum, and a clavicular head, which originates more laterally from the medial third of the clavicle, which is also known as your collarbone. Both of those heads or those portions will then insert onto the mastoid process of the temporal bone, which remember is that little lump that you can feel behind your ear, as well as onto part of your occipital bone. Now, these muscles can contract together at the same time, bringing the head or the chin closer to the chest. We call this neck flexion. Each muscle can also act independently to produce lateral flexion, which brings the ear closer to the shoulder, or opposite side rotation, where the contracting muscle rotates the head away from or in the opposite direction to the contracting muscle. So if this sternocleidomastoid muscle is contracting, it will rotate the head to this side. Moving on to the blood vessels that supply the head and neck, and blood leaves the heart via the aorta, which is this large vessel here. We'll talk more about the aorta and its different parts in more detail in the next module. From the aorta, this first branch is called the brachiocephalic artery. And it's named so because it then divides into arteries that supply the brachial or the arm region with blood, and the cephalic or the head region with blood. So from our brachiocephalic artery, we have our right subclavian artery, sub for underneath or below, and clavian referring to our clavicle. So it runs underneath our right clavicle to supply blood to the right upper arm. We then have our right common carotid artery, which runs up the right side of the neck. We have our left common carotid artery, which branches directly off the aorta and runs up the left side of the neck. And combined, both of these arteries are simply referred to as our common carotid arteries. Our final vessel, which also branches directly off the aorta, is the left subclavian artery, and our left subclavian artery supplies blood to our left arm. Looking at those vessels from another angle, and we have our brachiocephalic artery here, our right subclavian artery going under the clavicle there, and then our right common carotid artery going up the right side of the neck here. On the other side, which we can't see on this image, we would have our left common carotid artery running up the left side of the neck, branching directly off the aorta. And we would have a left subclavian artery also branching directly off that aortic vessel. Looking at the vessels which then return the blood to the heart, and our veins are named quite similarly to our arteries. So we have our right and our left brachiocephalic veins. So again, brachiocephalic because it branches into regions vessels that feed our brachial and our cephalic regions. We have our right and our left subclavian veins, which drain blood from our right and our left arms. And then the only difference is that we have blood returning from the brain, the face, and the neck via two internal jugular veins. So not common carotid veins, we have two internal jugular veins. These two veins sit more medially. And then blood from the scalp, as well as regions of the face, the mouth, and the neck, return blood via two external jugular veins, which sit more laterally. Once more, looking from a lateral angle, and we have our right brachiocephalic vein here, feeding into our right subclavian vein here. We have our right internal jugular vein, which is this thicker, but also the more medial vein, and our right external jugular vein, which is the thinner vein and also runs on the outside of the neck.